I want to take a moment today to talk to everyone in the community to express the importance of the need to social distance, to adhere to the restrictions and the guidance that comes out from the federal government and from the governor's office here in the state of Maryland, and especially speak to the millennial population. No one is immune to the virus. We all must take into consideration everyone's safety, and the millennial population, I know there's a misnomer out there that that population is not getting sick. Well, I'm here today to tell you that that population does get sick, and unfortunately, sometimes when there is sickness within individuals within that age group, they may not know it, and they may continue to be in the public and spreading the disease to the more vulnerable populations. So it is incredibly important for everyone, millennials included, to heed the advice of public health professionals, the governor's office, and the federal government to social distance, to maintain the 6-foot circumference from individuals that are sick, to cover your coughs, wash your hands, and to not gather in large groups. It is critically important for everyone to heed this advice.
Hi, I am Hagerstown Fire Chief Steve Lohr. I would like to take the opportunity to share with you how the members of the Hagerstown Fire Department are continuing to serve you, our citizens, during this national emergency. First, we are maintaining our daily readiness with full staffing at our 6 locations throughout the city. We are aggressively following the best practices issued by the Center for Disease Control to minimize the spread of our COVID-19 virus across the workforce and throughout the community. Secondly, we have taken extra precautionary measures in the form of additional personal protective equipment and training to best serve you and your families. Remember, you will see HFD EMTs as first responders to serious medical calls, since many times we are the closest resource to your emergency. Finally, we are changing the way we interact with each other in large groups. We have successfully deployed Wi-Fi technology to have virtual shift meetings and training to keep our folks in their respective stations in your neighborhoods, while continuously training to best serve our citizens and visitors. Even though we have canceled visitors to our facilities and gatherings of more than 10 persons, the men and women of the Hagerstown Fire Department stand ready 24 hours a day to do what we do best: help you and your families when you are having an emergency that can be the worst day of your life. Please remember, wash your hands frequently and thoroughly. Disinfect surfaces and objects that you touch frequently, and monitor yourself and your loved ones for the signs and symptoms of the coronavirus. Take comfort in knowing that this virus is very serious and transmissible, but it is not invincible. Together, I am confident in our ability to get the spread of the virus under control and lead our great city back to a state of normalcy. Practice your social distancing and adhere to all of the recommendations to slow down this virus until our scientists and physicians develop the tools needed to beat this malady. May God bless you and your families during this most difficult time.
Without a doubt, we are in midst of an unprecedented time in history. As president of the Washington County Board of County Commissioners, I am here to assure you that we are in this together. Our staff is working around the clock to provide support for our healthcare workers, first responders, educators, businesses, and everyone who is on the front lines as we work together to flatten the curve.
It is important to note that while county buildings are closed to the public, all services are still available to the community. From landfill operations to permits and inspections to highways crews and wastewater treatment plants, all critical infrastructure continues to operate as normal in Washington County.
Governor Hogan has closed non-essential businesses and has asked us all to remain home as much as possible to stop the spread and to flatten the curve. We know that Washington County is home to many beautiful parks and trails, So we ask that if you venture outside during this beautiful springtime weather, to maintain social distancing of at least 6 feet, to not let your children play on playground equipment and steer clear of pavilions, and certainly don't gather in groups of larger than 10.
Many of us have never experienced anything like the days we're living. It is important that we follow directives to help protect one another. We recognize that many of our community members work in fields that are considered critical infrastructure. For those that must leave their home during this time, please wash your hands, cover your face while coughing or sneezing, and stay home if you're feeling ill. Thank you.
Small businesses are the heartbeat of our communities across the country. We stand with you during this time of uncertainty and are here to provide resources to help. We have witnessed a surge of creativity in our businesses as many are working hard to find solutions to continue operating and providing services to our community. Thank you for continuing to choose Washington County as your home for business.
Now, more than ever, is the time to come together as one in Washington County. We must make every effort to protect those most vulnerable in our communities. Thank you again to all who are working the front lines to keep others in the community healthy and safe. To stay informed with the latest updates, we encourage you to visit washco-md.net, coronavirus-info.
I'm here today to answer one of the, or at least attempt to answer one of the questions that I think everybody has is, and that we get often is, when is the peak coming? It's a very fluid, rapidly changing situation with this virus. There are many, many individuals out there that are doing modeling. The modeling that the state of Maryland has been doing in conjunction with the University of Maryland, Johns Hopkins University, and several others indicates that potentially the peak may not hit Maryland until early July, but other modeling that we're seeing is anywhere from the middle of May through June. That is not necessarily a bad thing because, again, we are attempting to flatten the curve, and when you flatten the curve, you sort of elongate the peak, so to speak. So we're not getting it all at once, it's over a period of time. So over the course of the next 2 to 3 weeks, we should be able to have a good sense of whether the social distancing and whether the restrictions that we have in place here in Maryland are working. We should expect to see case counts continue to rise because testing is increasing. But over that period of time, we don't want to see doubling and tripling of numbers that we're starting to see now. We want to see sort of a steadying off of numbers and, you know, gradually hitting that peak and then on the downward slope.
I'm Brian Albert, Operations Manager of the 911 Center, and we're doing some different things with the introduction of coronavirus into the county. We have split our shifts, so we have all our day shifts are operating out of Elliott Parkway where our primary 911 center is, and then all our night shifts will be working out of this center. I'm at the backup center here in downtown Hagerstown. So we've enacted some cleaning, not that we don't clean on a regular basis, but we're cleaning at least 3 to 4 times a shift. Plus we have professional cleaners coming in to clean the centers whenever they are not being used. So some of the questions that you may be asked if you do call 911 and would be, does anyone on scene have a fever or cough? And that would give us indicators to be able to let the first responders know that it is a possible person under investigation, which we call a PUI, and that would be, that would possibly have the coronavirus. And then they take precautions. They would elevate their personal protective equipment when they respond to a incident or scene. That's for police, fire, or EMS. So, and then another thing that we're going to be implementing later today, we will be asking if you're able to meet the responders outside or at the door of your residence or building that they're responding to.
Just wanted to take a moment to talk a little bit about the importance of social distancing. As we've stated before, no one is immune to this disease. COVID is rampant amongst the world, the United States, and obviously here in Maryland. We should operate on the assumption here in Washington County that it's all around us. And we also need to take heed to the governor's restrictions, especially with social distancing, and especially that no one's immune to this. Younger populations, older populations, everyone is in the same boat together. Just because you're a younger individual and you may feel as though you have a more robust immune system, you've heard that even if younger individuals get it, they will exhibit milder symptoms of the illness. It's still critically important for you to stay inside, not acquire the illness, because in turn, what you could be doing, and in a lot of cases what you probably are doing, is if you aren't social distancing and you don't feel that bad, you could be passing it along to more vulnerable populations and more vulnerable individuals within our community. So it's critically important that everyone, and I repeat, everyone, social distances and adheres to all the restrictions that the governor and the federal government have in place.
The landfill is considered an essential service in Washington County. Under the current state of emergency, we are urging all residents to please refrain from bringing bulk items and yard waste to the landfill. You are putting both yourself and our staff at great risk of contracting COVID-19. We recognize many people are home cleaning out garages, attics, and houses. While we encourage spring cleaning, please do not bring these items to the landfill until the state of emergency is lifted. Your cooperation in this matter is essential to the health and safety of Washington County.
Hi Washington County, this is Susan Small, your Director of Business Development. I just want to take a couple moments to share with you that the Washington County Department of Business Development is really in this with you and your business as we get through this together. The last 2 weeks are unlike anything we've ever experienced in our lifetime, and as we navigate this new territory in the coming days, weeks, months, we want you to know that we're going to stand strong with your families and of course the entire business community as we have to learn a new normal. Our main priority in this moment is going to be the health of the community. We recognize that our businesses are a critical part of our infrastructure, and that's what keeps our community moving forward, even in the midst of a global pandemic. We're very thankful and grateful to all of you who have worked tirelessly to make this happen. We have witnessed businesses getting incredibly creative with finding solutions for online orders, delivery, takeout, options in the restaurant industry, as well as manufacturing who have started creating items to assist our healthcare workers. And while we remain optimistic about the future of business in Washington County, we recognize some of you may be wondering, how to move forward with your business while it's been put on pause for the moment. The state of Maryland has issued some very important financial assistance measures for businesses that we want you to be aware of. And if you go to www.washco-md.net /business/development, we've compiled a list of both state resources for the Emergency Relief Fund, as well as the federal government's announced their financial assistance for businesses who are also in need due to COVID-19. So we encourage you to visit that website. Additionally, we just really want you to know that our team is here to help you. Even though we are working remotely, all of us are here. So please reach out if you have any questions about how to move forward or resources that might be available. We want you to know that we're here to serve you, and we will get through this and become better together. So hang in there, and for now, take care, be healthy, and we'll see you soon.